G'day and welcome back to the channel. So in today's video, I want to show you how to correctly wear a shoulder sling to improve your rehab efficiency, but also decrease the risk of accruing any unwanted additional dysfunction for the life of that sling. Now, thankfully, I don't have a shoulder problem, but this is a topic of conversation that I tend to have a lot because there's some really subtle things to be aware of when you're wearing a sling to optimize that experience. But as I said, it's really easy to accrue a whole bunch of extra dysfunction that you then have to address once you come out of the sling that you can potentially avoid with a few basic tips and tricks while you're wearing the sling. Now, there's obviously a number of different reasons why you could end up having to need a shoulder sling. The first one is clearly a shoulder injury, whether you've broken your collarbone, dislocated your shoulder, whether you've had some shoulder surgery to repair something. But you can also be put into a shoulder sling if you've got some elbow dysfunction, even wrist, hand, and finger dysfunction, if the goal of initial treatment is to immobilize an area. And obviously, if you're trying to immobilize something, they're trying to create a very stable environment to give that tissue the best chance to mesh. But unfortunately, the trade-off with immobilizing something is obviously that things that are immobilized have more capacity to get stiff, to become tight, to get weaker, and to lose some function depending on the length of time that you're exposed to that immobilization. So one of the things we need to make sure that you do is that when you're putting on the sling, the number one thing we need to think about is the position that you are in. So what I want to go through in this video to start with is you want to make sure that you understand the ideal shape for you to be in so that when you're in the sling, you can strive for that position as much as you feel you can. If you have been told that you are not supposed to actively move your shoulder, then you shouldn't be actively moving your shoulder to reposition the sling. Instead, most people are allowed to passively move the shoulder, where you think of the shoulder or the arm as a lifeless piece of weight, and you're using your other side to sort of shift that arm into position. If you've been told not to come out of the sling, maybe have someone help you with this so you can just focus on stabilizing yourself at the same time. But again, be respectful, use your common sense, and make sure that you're doing what's appropriate to you specifically. But the important thing to think about with any brace or any sling is that it has to be based upon a good shoulder posture. The reason for this is that if you, for example, have had rotator cuff surgery where that supraspinatus muscle or one of those muscles has been repaired or reattached or something like that, if you are in a bad posture where gravity is consistently pulling down through your shoulder, then there's going to be consistent tension on an area that may be healing, that may not appreciate that over the course of 2, 4, 6, 8 weeks, however long you're in the sling for. But more importantly, on top of that, is that if you're consistently in a bit of a slouchy posture, which is very easy to do, the weight of the arm and the shoulder complex directly pulls on your neck, directly pulls on your upper back and the tissue in that area, which is generally the main reason why a lot of people who have to spend a lot of time in a sling often develop some soreness in this area. And as I said at the top of the video, the reason why it's really important to try and counteract this straight away is that we have to treat this at some stage. If you've developed some extra stiffness and tightness in your neck, and once the sling comes off, you also have to begin your rehab for the issue that puts you in the sling in the first place, it just adds extra layers to your rehab that you can hopefully avoid by doing some simple things. Before you put your sling on, make sure that you have your shoulders back and potentially up a little bit. And we want to basically slap the brace of the sling on top of this position, just so that you feel supported, so that when you let go, it still feels like it's in the same shape. You don't feel like you're rolling around and perpetuating that dysfunction. Now, obviously, everyone's sling can be different, but for this one has two particular straps, one that goes around over the top and one that wraps around the back. Now, if you've had to put on a sling with one arm before, you'll know that it's a genuine pain in the bum. But what I would recommend before you put it on is make sure that the straps aren't stuck together. It sounds simple, but there's nothing worse than putting on a sling and then having to sort of reach around and play around, and all of a sudden everything's connected and it takes extra time and it's a bit more annoying to put it together. So the first tip is really just to make sure that nothing is unnecessarily stuck together. Now with this particular sling, it's always best to put your hand in first and then grab something on the other side just so that it doesn't move away from here, because we want to make sure that when you have your elbow in there, the elbow goes right down into the base of that sling, into that cradle. If you try and go elbow first, obviously, it's really hard to then get your hand in. So please make sure you put your hand in first. So we need to make sure that you're in there as deep as you feel you can. So again, the strap over the top, come around here. We don't want to worry about the positioning just yet. We just want to make sure that we can get you sort of started. So I always get people to just loosely try and stick it on there first, just so that it doesn't go anywhere. And then if you can reach around and find the other one, and then slide that in through here as well. Now, once you have a basic starting point, we want to make sure that you're thinking about taking those shoulders back as best as possible. Your hand and arm should not be around towards your other shoulder. If it is, it's going to create this rounded shoulder posture that we're genuinely trying to avoid. So what you might find is when your arm and shoulders are back, your hand is closer to the middle of your chest. And then from this position, you want to make sure that you reinforce this enough so that you feel like when you relax, nothing changes. And then once you've done that, you've got a really well-supported position that's very safe for your shoulder, but also there's no extra tension up through that neck and upper back that we're then going to have to address afterwards. So the other thing to note as well is if you do have an elbow, forearm, hand, or wrist issue, it's really important to make sure that that is elevated above sort of parallel, just to make sure that we're not allowing any of the congestion or any of the swelling to travel down into your hands and fingers. But that shape in isolation is a very good starting point to build from, to make sure that all of your tissue is loaded correctly, making sure that your shoulders are back, making sure that you're up nice and tall and away from this rounded position. Because we need to make sure that the time you spend in this brace or this sling is as optimized as possible, so we're not adding any additional dysfunction that you then have to get rid of afterwards. So the next thing that's really important to go through here is if you are someone who is having to wear a sling for a very specific reason, and you feel like your neck and shoulder and upper back are becoming a little bit more sore and uncomfortable than they should be, then there's a couple of really simple exercises you can do while in the sling, if you have to be in the sling, to try and counteract a lot of that sort of stuff. And what's really important to differentiate here, even though you may be having some genuine shoulder pain from your surgery or from your injury, there can be a bunch of extra stuff that is, by all intents and purposes, disconnected from your specific injury site that you can get on top of. So it's good to divorce those two ideas, because if you have a really sore neck and upper back, so if you're really confident that you're trying to get into good positions, you're trying to avoid getting into some bad sort of slouchy shapes with that shoulder, one of the things that you can do, and again we do this on the channel all the time, a tennis ball or a lacrosse ball or any ball for that matter is a fantastic tool to utilize to find any of that stiffness and dysfunction, that pain, and respectfully ask it to go away relatively quickly. Now you have the option of doing this standing. You can do this lying down if you want to. Lying down is generally the best, but it depends on how you are able to get up and down with this shoulder and how your shoulder feels in that position. Generally, most things feel relatively good in sitting. So one of the things that you can do, and you can do this as much as you feel comfortable doing, is you can place the ball into that upper back area, and you can maneuver yourself around and go looking for anything that feels stiff, tight, tender, or uncomfortable. Now again, if you know where your injury site or your surgical site has been, then just obviously don't put the ball in that area. If there's some incision sites that you've had post-op, or you're dealing with post-op, then obviously avoid jamming the ball into that area. But everything around that is fair game. And then again, once you've sort of rolled to one side and hunted around, you've found something that feels a little bit dysfunctional there, all we want you to do is just relax and stay here. We're going to give you some time for that ball to press into that tissue, to reflexively ask that muscular tissue to give, but to also get into the deeper joints and prompt that tissue to release or to de-stiffen or to move better. And it's a really simple way to try and maintain some freedom and some muscle integrity or some muscle function and some tissue function through here while you're trying to recover and get things to heal. It can be a really nice way to get on top of some of those unnecessary aches and pains if you feel like you've developed them from maybe being in a bad position, but it's also a great way to try and improve the function of the area and maintain that function until you get out of the sling and feel better. Then moving the ball down a little bit, up a little bit, out to the side towards your shoulder blade a little bit more. Hunt around for anything that you feel is dysfunctional that doesn't need to be there. And again, you can do this while you're watching TV, do it while you're doing something else. But the point being is, you should feel immediately a little bit looser and a little bit nicer afterwards. So if you found that helpful, let me know in the comments down below. Please leave a like rating on the video, subscribe if you're new. Please consider leaving a super thanks donation if you enjoy this type of content and you want to help support me and the channel going forwards. But with that being said, hopefully your posture improves from there, and I'll see you in the next one.